Imagine diagnosing a patient with like microgravity-induced bone loss right in your local clinic, and then having NASA foot the bill.
I mean, it sounds completely like science fiction.
Right. But today we are looking at the extreme edges of clinic revenue. So welcome to today's deep dive. We're analyzing a really interesting stack of sources today. We've got the 2026 CMS physician fee schedule from Prevounce, some recent Florida legislative summaries, Becker's ASC coding quirks, and NASA's Treat Astronauts Act.
Exactly. And our mission today is to uncover those hidden revenue opportunities, billing intricacies, and regulatory shifts. Basically, we want to highlight the relief designed specifically to help you, the physician owner of an SMB clinic, maximize your bottom line.
Yeah, absolutely. So let's start with capturing revenue you're probably already generating but, not getting paid for. I'm talking about remote patient monitoring, or RPM.
Oh yeah, RPM.
Yeah.
It's historically been a huge administrative headache for clinic ROI.
Exactly. The old rules treated patient data like this grueling marathon. Like if your patient didn't cross that 16-day finish line of continuous physiological data, the race just didn't count. You saw $0. It was essentially an all-or-nothing buffet.
Right. But the 2026 CMS rules completely changed that game. First off, the CMS conversion factor finally increased.
Oh, wait, the base multiplier?
Yeah, exactly. The base multiplier for calculating Medicare payouts is pushing up to $33.57 for clinics that are participating in alternative payment models.
Okay, that's a nice bump. But the real shift is how the races actually run now. There are new codes, right?
Yes, so CPT 99445 now covers just 2 to 15 days of physiological data. And then you have CPT 99470, which covers much shorter 10 to 20-minute staff time increments.
So going back to that buffet analogy, it's like they're finally letting you get paid for serving the appetizers, not just the massive multi-course meals. I mean, these codes shift RPM from being just a long-term chronic care tool to, a short-term acute care tool.
That is a perfect way to look at it. CMS is finally compensating you for reality. Like, say you have a patient adjusting to a new GLP-1 medication.
Right. Very common right now.
Extremely common. And maybe you only need a week of blood pressure data to ensure they're safe. Now you can actually legally document and bill for that shorter interaction. It aligns your financial reality with the clinical need.
Wow. Okay, so RPM rules are finally letting you capture lost revenue on the clinical side, but capturing that revenue is really only half the battle if middlemen are quietly siphoning it away on the pharmacy side.
Oh, pharmacy benefit managers, or PBMs.
Yeah, PBMs.
Yeah.
So since we're optimizing your SMB clinic revenue, we have to look at these new state-level legislative protections. Like Florida's recent legislation is aggressively targeting PBMs.
Yeah, they've historically squeezed independent clinics using really opaque tactics like spread pricing. But Florida is banning those financial clawbacks. They're mandating pass-through reimbursement models instead.
Which means the PBM has to reimburse your clinic the exact amount the health plan paid them. No more keeping that massive difference. Plus, Florida broadened access, right? Like, telehealth definitions legally include audio-only calls now.
Exactly. And physician referral exemptions no longer require direct supervision on site. They're relying on standard Medicare payment rules instead.
Okay, but I have to push back here for a second. We're looking at the sources and impartially reporting this, but, legislation acts like a game of whack-a-mole.
Oh, for sure.
If Florida bans spread pricing by law, does it actually force PBMs to play fair? Or will they just pivot and invent new loopholes to squeeze independent clinics, like going from margin skimming to fee stacking?
Well, that's the critical insight you have to keep in mind.
Yeah.
Banning spread pricing doesn't solve the margin squeeze, it just moves it somewhere else. PBMs will inevitably invent new, highly complicated administrative fees.
So your contract auditing strategy has to completely shift.
Right. Instead of just looking at drug cost discrepancies, you now have to ruthlessly scrutinize every single administrative line item to make sure new fees aren't quietly eating your margins.
Definitely. Navigating those PBM loopholes takes serious precision, but sometimes you actually need that extreme precision for the patients themselves. Let's look at the absolute extremes of clinic billing.
You're talking about the Becker's ASC report.
Yeah, the one highlighting hyper-specific ICD-10 codes. We're talking literal codes for orcabytes and spacecraft accidents.
I mean, it sounds ridiculous on the surface, but mastering that level of extreme coding specificity is absolutely critical for ASCs and clinics to ensure proper reimbursement, no matter who walks through the door.
Because treating space-related conditions is a real possibility.
Right.
Which brings us to the NASA Treat Astronauts Act.
Right. Under this act, local healthcare providers can legally treat former U.S. astronauts for spaceflight-associated conditions. That is, if traveling down to the Johnson Space Center is unadvisable for them.
And the crazy part is NASA acts as the secondary payer. So after primary insurance processes the claim, NASA covers the remaining out-of-pocket costs with zero cost sharing for the patient.
Exactly. Whether it's a routine hypertension check or a former astronaut with a microgravity-induced bone issue, your clinic's revenue relies entirely on accurate, hyper-specific documentation.
It really does. So to sum it all up, from that new RPM billing flexibility to defending against PBM fee stacking to literally treating astronauts, there are constantly evolving avenues to maximize your clinic's profitability.
Right. It's all about capturing the full value of the care you are already providing every single day.
Absolutely. Which leaves you with one final thought to mull over. As commercial space tourism expands rapidly, will your SMB clinic soon rely on those exact same short-term remote patient monitoring codes to track the vitals of space tourists right from your local office?